Hello, this is Dr. Lewerenz at Longevity Health Institute in Rochester, Michigan. Hope you're well. Again, we're in October here, Breast Cancer Awareness Month, and I had a couple patients today that one actually had some latent history about 15 years ago of breast cancer, so fresh in my mind. And I also had another patient that we were working on today, weight loss and gut health and regenerating liver methylation and function. And she's doing lovely after 4 visits, about 5 months. She's lost actually 70 pounds and handling her bipolar wonderfully. But she does have a genetic SNP with her liver, and it's called MTHFR, which I'm going to discuss with you. But this is a very key genetic single nucleotide polymorphism, which basically means a genetic variant or SNP or dysfunction that you don't methylate and you don't detoxify as well. And there are risks to that with patients that have cancer, including breast cancer, and people that have neurologic and psychological disorders, as well as even depression, bipolar, anxiety, Alzheimer's, dementia. So I know there's a lot of wide variety here of topic, but the key thing is something that can be easily tested, that can prevent a lot of disease, that is an enzyme deficiency called MTHFR. MTHFR stands for methylenetetrahydrofolate reductase, and it's a deficiency. And again, back to, it's a genetic SNP, and there's variations in this that can be easily tested in your blood. In fact, we use a couple laboratories. One is Biotech and Cleveland Clinic laboratories that run these for $25, I think $35, and you get a very good profile to see what your risk is, and then you could complement that with what's called your homocysteine level, which is a protein byproduct that comes from your liver from animal product foods. And if that is high and you have MTHFR and your homocysteine level is high, you know you need extra methylfolate, extra methyl B12 and B vitamins. You can actually take some cysteine, and these are all things that help your liver methylate and detoxify and reconjugate things. The key thing here is with MTHFR is that you're preventing and really influencing a lot of conditions and disease. You're preventing cancer. Helping methylate helps you detoxify and eliminates a lot of toxic burden and risk, but also you're helping your body metabolize, which increases your metabolic rate. With aging, your liver will slow down and it will methylate, less. So making sure that you are a good methylator and having lower homocysteine levels is very key. The other thing, and again, I know all encompassing here, even cardiovascular wise, there is a much higher risk of cardiovascular events and vascular events in people that have MTHFR. And just taking folic acid does not do the trick, because the SNP or the defect is in the enzyme related to methylation. So you would need what's called methylfolate. So again, what's key is methylfolate, methyl B12, cysteine. These are all things that help your liver methylate and bring down homocysteine. The lower your homocysteine level is in your blood, the better your liver is functioning, and the higher your nitric oxide is, which helps circulation and helps vascular integrity. So blood pressure is lower, blood circulates better, you're at a much less of a risk for any cardiovascular event. So to summarize, a lot of stuff, a lot of quick information, but to summarize, you want to check your MTHFR. It's very important. It's about 17 to 22% of the whole U.S. population have a SNP in this, either 1 to 4 variants, and that's why the range. It's easily to test, and it will help prevent cancer and or treat cancer, prevent cancer, Alzheimer's, neurologic conditions, psychological conditions, and cardiovascular events. So get your MTHFR tested, check your homocysteine levels, and continue to be well. So this is Dr. Lewerenz, Longevity Health Institute. We're always happy to inform you and educate you here and get you the best result in personalized functional medicine. We have 2 offices, opening one in the west side in Bloomfield soon, and I have a few providers, and we do wonderful things to keep you well, keep you out of the hospital, keep you thriving, as I say, not just surviving, and preventing. We're all about prevention and wellness. So again, Dr. Lewerenz, Longevity Health Institute. Have a good evening.